what we learned over time is that the virus was easily killed by hand sanitizer. That's fine, but there wasn't much transmission by hands. It was almost all through the air. That it took hours of close contact before the virus would be transmitted from a symptomatic person to a susceptible person. The Chinese published that 85% of the spread occurred within the home. So people weren't getting it at work, or they weren't getting it at church or congregant settings or at school. It was actually being transmitted in the home. That takes about 3 hours of contact at home before it would transmit. And then the big focus on masks really almost became political or punitive or divisive, that someone wasn't wearing a mask, or someone didn't wear the right masks, or people weren't wearing two masks. And it just, the news cycle just over and over on masks. And the message that was really lost through all this is that the masks don't block the virus. It's obvious. And a lot of these masks, you can actually see air flowing right to the nose or mouth. It's obvious there's no physical barrier there. And the virus is sufficiently small that it moves in and out of the mask just fine. But the big thing we missed was oral nasal hygiene. And what was learned in other parts of the world is that just like the virus was killed by hand sanitizer, it was easily sterilized by 1% povidone iodine. It was easily sterilized by dilute hydrogen peroxide, by Lugol's iodine, even by sodium hypochlorite, a few drops of household bleach in a glass of water as an example, or even scope or Listerine. So other countries started moving with oral and nasal decontamination. Even dentists started doing this. They started doing it on themselves, sometimes their patients, because they were in the mouths of patients all year long and didn't hear about dental outbreaks. They realized that the virus was in the nose and mouth for 3 or 4 days. And so there was an opportunity not only to prophylax with good nasal oral hygiene, but also to actively treat. And then a paper later on was published in January of 2021. We found out about it earlier by Chowdhury and colleagues, showing in people who were developing COVID-19, they knew they had it, they test positive, they were younger people that wanted to be in research, that they basically were randomized, about 303 people were randomized to dilute povidone iodine with oral nasal rinses and even eye drops up to every 4 hours versus fundamentally a control using lukewarm water. And they showed about a 75% reduction. They basically aborted the infection. They cut off the infection before it became symptomatic. And there was a concordant reductions in the few cases that were hospitalized or died. So we missed this oral nasal hygiene key prophylaxis message that many parts of the world to this day rely upon.